Lord, I'm very thankful for our sister, for the ministry that she's had, many types of ministry that she's had. And we thank you for the ministry she'll have with us this morning. Lord, be with her. Encourage her heart, strengthen her, give her the energy for a full day of teaching and training and encouraging through word. So bless her, we pray, and help us all to be blessed through her. In Jesus' name, amen.
Hello. Well, it's such a beautiful sunny day out. I appreciate your sacrifice to come here rather than to play in the leaves, because it's quite glorious out there today. So today we're going to talk about a subject that can be quite triggering for some people. And if you find yourself getting triggered, you know, if you find that your nervous system's getting jacked up and you feel free to get up and go get some fresh air and take care of yourself. And then I hope you come back again. We're going to talk about some look at trauma, dissect it a bit. What is it? How does it affect our body? How we can take care of ourselves, and then how can we be effective in being an ally or a support to someone else that is experiencing the effects of trauma and addiction in their life. Yeah, I should mention that. We're talking about the marriage between the two. For so many years, addiction was treated very separately. And trauma is a relatively new in the sense that it's just really being recognized in recent years. And the fact that we're now stating that trauma is the cause of most addiction is still considered kind of a radical statement. And so we're gonna examine and explore that. So I'm really thankful to Karn for inviting me to come and to be here with you. And I want to just say up front, I have never met a person who has chosen to be an addict. I've worked for 40 plus years now with addicts, with people who are substance using, who have experienced homelessness or are newly released from institutions. And I've never met a person who said, this is the life I chose for myself. One of the things that we know about trauma is that women are at a greater risk than men. And not that men aren't also at risk, but women are at greater risk than men. And it's been found that women are twice as likely to develop PTSD, post-traumatic stress disorder. And within women, sometimes the symptoms can last 4 times longer than they do in men. Now, why is that? That's kind of curious, isn't it? It might be the enculturation, that women are more predisposed to be asking for help and to really feel beyond the surface, whereas culturally, men are often told to have that stiff upper lip and, pull yourself up by your bootstraps and, don't be a wuss, and all these type of messages that can cause them to push the trauma down. Okay, so we know that trauma affects you mentally, physically, socially, spiritually. It affects all aspects of your life. That there are different types of trauma, that some as a result of a single traumatic experience, And we would call what rises up from that, post-traumatic response, like a sexual assault, like a fire, like an accident, hospitalization, loss or death of somebody close. Even war is considered a single event trauma, in that it might have lasted for a prolonged period of time, but it was something that happened. Everybody knew you went to war. Everybody knew you came back from war. It was validated. And you don't see that in this other type of trauma that we call complex, where you have complex post-traumatic responses. This is when you have early onset traumatic experience. And I might add, an experience that's either real or perceived. If you think you had the experience, your body will still encode it as if it actually happened. And you will suffer the symptoms of that. But usually the complex trauma is early onset and it's repetitive. It happens over a period of time. It usually has some sort of aspect of containment, in the sense that starts as a child. You can't easily leave the home. You can't easily leave your situation. And because of that, we say that the complex trauma happens in that early part of life, but it also happens in situations where there's prisoners of war, where there's been that containment. It also happens in incarceration. It happens in domestic violence, if you don't have the ability to leave your situation, resulting in overwhelming experiences of helplessness, of fear and powerlessness. So there's a whole new study in the last few years called epigenetics. Epigenetics just brings into focus what the Bible and the indigenous community have known for many years, is that the sins of the fathers pass down the generations, that there is an intergenerational connection to trauma. I know in my life as a survivor of trauma, when we did the family tree, right back to my great-grandparents, there was sexual abuse that had happened. And the trauma that somebody in your past, an ancestor in your past, has experienced can affect you in your life today. Now, how is that? Well, when you're floating around in utero, I like doing the swimming in utero, in the amniotic fluid, if mom has experienced trauma herself, if she's experienced overwhelming fears, stressors, then she's producing an overabundance of cortisol. Cortisol is the stress hormone. And this stress hormone brings about inflammation inside the body. And what can happen is the tiny little baby, as the baby grows, is already infused with the stress hormone, may be born with a great lack of resiliency to even the smallest stressors. This is why in a family, sometimes I might have like a number of sisters that come in and they tell me they've all been sexually abused, but they all tell a very different story about how it's affected them. Some of them have greater capacity for resiliency than others. This is why, some children maybe have not experienced trauma in their life, but just seem to not be able to handle, what we would think are simple disappointments or simple adverse experiences. But so we know that this epigenetics is at play. We've heard it in the indigenous community, and we see it in the intergenerational trauma that's happened with the residential schools, with the 60s scoop, with, being taken from their culture, being taken from their people, being taken from their families. So there's many types of trauma. I want to talk initially that the trauma can happen right at the beginning. And I want to just put out there a caveat that I'm not parent bashing, because I think most parents really love their children. And I think they do the best they can do with what they know. And, there's a lot that we didn't know. Like I grew up in the 50s and, we followed Dr. Spock's book on parenting. And he used to say, well, if your baby's crying, shut the door, leave them crying, and, don't pick them up and coddle them. They're going to become, selfish children and are super needy. And if they get out of line, you make sure that you give them a strong, cuff upside the head. You maintain the power and control always. And we did things that we don't do anymore, that we call abuse now. I remember as a young nurse, helping with a circumcision, and they put the baby boy, they strapped him on a board, and then they came over and they just chopped him. There was no pain medication. There was nothing given because they felt that children didn't feel pain. And it was felt that, children could go through all kinds of stuff and it wouldn't affect them. They don't remember pain. Well, we know different now. And trauma is a relatively new science. And in the last 5 years, we've come leaps and bounds in understanding how trauma affects the nervous system and how trauma can have devastating effects on growth and development. So the lack of that soothing, oh, beautiful baby, coochie coo, that mirroring, looking at the baby, which is so important. If that doesn't happen, if there isn't that attunement with the child, that makes the child fearful. That makes the child feel unsafe. As I said, there could be real or perceived fears, including that sense of abandonment. The child usually figures out if their world is safe or not by age 3. If there's this, a sense that mommy isn't there or the caregiver isn't there for them, when they cry, they don't get attention. When, when they're hungry, they don't get fed. Then the sense that the child can have is that they're abandoned. And that will translate, even as the brain is growing and developing, into a sense of that the world is not safe. My world is not safe. And as that plays out later in life, then people, places, things are not safe. And it affects into adulthood. And we talk about attachment, the ability to attach in relationships. And we used to think that attachment disorders only happened in children, that some children will, you may be gone for a while and they trust you're coming back. And so they run up to you when you come back. Other children who are afraid that you're not going to come back may protect themselves and pull themselves away. And what we've now conclude is that the studies that were done in the 40s by a Dr. Bowlby around attachment, that our attachment styles affect us into adulthood. It affects how we relate to each other, how we deal with intimacy, how we deal with our friendships and our relationships, whether we're close and secure and feel like, we can trust, I can trust you, or whether we're dismissive and, keep a distance because I'm afraid you're going to hurt me. and just how we attach. So trauma can also be, that neglect. Mom and dad are trying their best to work hard to give the kids all the toys, but mom and dad don't have time for their children, are just not spending time with their children. And the child takes that in as being neglect, as I'm not important enough, I have no value, and that begins to shape their worldview. Neglect, I'm hungry and there's never any food. I'm left alone for long periods of time. Maybe it's even bullying. I'm at school. I remember I was always a little bit chunky as a kid and would get bullied a lot and get beaten up in the schoolyard. And I remember one day they called my mother in, and I was so proud of her because she said to them, "No one gets to beat up my child except me." And I thought, oh, she loves me. I would take whatever I could as being love. We often think of trauma in terms of the big T traumas, sexual assault, sexual abuse, torture, psychological abuse, physical abuse, financial abuse, in every way, verbal abuse. Trauma is trauma, it's, and when it accumulates over a period of time, it has devastating effects. Even if it happens in a greater degree in a one-time episode. I worked 15 years on the sexual assault response team and was with people at the bedside after they'd been sexually assaulted. These individuals have a greater chance of embracing healing more rapidly, possibly, than someone who has experienced childhood abuse or trauma. So we look at domestic violence. And another period of my life, I ran support groups, a program called OWLS, Older Women Living Safely. And this was for older women who were living with currently being abused in their marriages or their relationships. And I remember one woman getting up, she was 80 years old, and she said, "It's happened every night since we got married when I was 16 years old." And she was on the regular being sexually and physically abused. And as we worked through that year-long program, every day she used to go down to the mall and have a cup of tea there. And she knew all the security guards and that. And she talked to one of the security guards and said, "I'm ready to leave him, to separate from him, but I want to get him out of the house. I want to be in the house." And so he said, "Well, what you doing on Saturday?" And he said, "I got 4 brothers." And so they went down, they hauled him out, took him to the elder shelter, and she moved in there. She stayed in the house, and the procedure started, and she experienced the first step in some great healing. And today she's now a community leader in her 80s. She's found just new life. And there's also religious abuse. So as a teenager, I had lived on the streets. I had run away from home at about 13, and nobody looked for me after 15. And when I became a Christian in the Jesus movement, showing up at the house of the dreaded Jesus freaks, and once I stopped using my drugs, which were numbing me out so that I could cope somehow, my behavior became really erratic. The trauma stuff started coming up, and people were well-intentioned. They want to pray it away. And They would pray and pray, it didn't go away. And so then I was told I was full of demons. And then I regularly, would have to lie on the floor and they'd all put their hands all over me and to try and cast demons out of me. And I would space right out, like zone out the top of my head and feel like I could watch what they were doing to her, which was me. And it wasn't helpful. So this just went down. This just went down. So, and I'm no tech genie. So, okay. There we go. Anyway, so I had to really, over the years, thank you, get healing from even the way I was approached initially in the church. And even at that, probably for most of my life, didn't feel like I fit in. Church was very family oriented. I didn't have a family and somehow just, felt like an odd one out. Also addiction in the home growing up, when we know that that not only can be abusive, that constant chaos, that constant walking on eggshells, and but it also role models a coping strategy, that we see, oh, well, our parents, when they're stressed, they drink and get drunk and that seems to be the thing to do, that becomes a role modeling behavior. So we talked a little bit about the difference between PTSD and CPTSD, one being tending to be a single traumatic event, the other early onset repetitive event with long periods of confinement. So we talked about how trauma can affect us in every part of our being. That is emotionally, cognitively, how we think and make decisions and come to conclusions, physically in our body, because every time we're feeling anxiety or stress, we're pumping out this cortisol. And this cortisol, this stress hormone, causes inflammation. And you know that depression is inflammation of the brain, that diabetes is inflammation in the pancreas, that most autoimmune conditions, all autoimmune conditions are a result of inflammation. Inflammation decreases your immunity. And there are very few illnesses that actually have genetic predispositions, that many conditions happen because of an immune system that's been assaulted by cortisol, by this stress hormone. We have an exaggerated startle response. If there was a loud bang in this room, you'd see me probably jump. It's an involuntary startle reaction. And that probably comes from many years as a kid, flinching. It's funny, I went to a conference for people working in domestic violence, and it was a hot day, the doors were open and a car backfired. You could see in the room all these people jumping because oftentimes us folks that have experienced trauma like to work with other people that have experienced trauma. And, the joke at every conference I go to for therapists is that we're the ones should be the patients, so exaggerated startle response, loss of memory. Some of us have big blanks in our childhood that we don't remember, that we have no memory for. And we don't need to go to a therapist that's going to dig up the memories we don't know, because I believe that the memories will come up on their own when God knows you have the resources to deal with them. So they're not describing that you should be going back and trying to dig up past memories. In fact, we can do trauma therapy without you ever having to tell the story about your trauma, just by dealing with the residual effects of the trauma in your body. Sleep disorders. Perhaps you're sleeping too much. Perhaps you're not sleeping enough and you just flip and flop and you just can't get a good, decent night's sleep. Perhaps you have night terror and you scream in the night. Well, that's kind of settled down for me, but I had night terror for years. I remember going to a church retreat, and I always feel like I have a good night's sleep. And I woke up like 8 hours later, and everyone else in the dorm is like at the foot of my bed, just praying that whatever thing is in me would get the heck out of me, because I guess I screamed in the night. And so sleep disturbances, flashbacks. So flashbacks are when one of your senses gets activated, sight, smell, taste, touch, hearing, that one of the senses triggers a memory that goes back to the trauma and may create a complete picture. You may feel like you're right back there. You may feel the feelings in your body. You may think you see the images, and it can be very terrifying and it can be very intrusive. And so we often teach, for the care of a flashback is as you get to know your body and the responses, there's usually just a little bit of time at the beginning when you know a flashback's coming on that you can divert it. But flashbacks, poor concentration, if you always as a kid had to watch and be, hypervigilant like that, then as you grow up as a kid, you're probably still, you're all over the place. And for some people, they might say that looks like ADHD. And, but it can also be because of the trauma. Talked hypervigilance, hypersensitivity. Oh, you're super sensitive, even what anybody says to you, you are constantly in a state of danger. You are constantly not feeling safe. The trauma survivor will seek safety the rest of their life. For emotional safety, physical safety, safety in every way. And you might be super sensitive and always be thinking what the person has said means they don't like me, or they're making a criticism about me, or, not really understanding what's being meant in the relationship. And we talked hyperstartle reflex. So one of the things we know about trauma, and this talks about somatic effects, psyche is in the mind, soma in the body, is that it can do some significant damage to the circuitry in your brain. But the good news is, they used to say to me back in my hippie days when I was doing drugs, oh, you're burning out all your brain cells, but that turns out not to be the truth. That in fact, through what's called neuroplasticity, that we know that the brain is malleable and that we can actually rewire the brain. So that some of these places where we're stuck in hypersensitivity, in hypervigilance, where we're stuck, that things can be reframed and rewired. So, of course, trauma can contribute to all sorts of psychological distress, but a lot of it is in your autoimmune system, and it affects your nervous system. And one of the things we have to learn is how to regulate our nervous system, because every cell in your body has a memory receptor. And so the fact is that every time you got smacked, you were grabbed in the upper arm, like grabbed the arm. And that was the precursor to you getting smacked. Later in life, if somebody were to grab you right in that spot, you may not have a memory of it, but your body may react. So we were talking about an individual's abuser, and the first time she talked about it, all of a sudden she broke out in hives. like all over her body, big welts. And we probably talked about that situation for about 3 months. For 3 months, every time she'd start to talk about it, she would break out in welts. After that, she didn't anymore. Some people get facial tics. Some people get all kinds of different reactions. How it changes your circuitry, it can change your temperature control center so that it's freezing cold out, you feel like it's warm. You go outside and you feel oblivious to the cold. You know, it's boiling hot, you feel really cold. You have infection in your body, you don't get fever. You know, it can just kind of jam up your system like that. So, yeah, so part of what ends up happening in the body too can be, you know, all kinds of physical illnesses, irritable bowel syndrome. We know that the gut biome is where the cortisol is produced from. So folks may have a lot of problems with digestion, with their bowels, with, you know, in their gut. They may find that their behavior is either inward directed or outward directed. Inward into depression, into lethargy, into anxiety, into suicidal ideation, always thinking of wanting to die, maybe doing the suicide attempts. But folks that have chronic post-traumatic stress, many of them fall asleep at night thinking of the thoughts of being dead, you know, because that seems like a relief. And outward directed are things like being extremely impulsive, you know, being angry all the time, being very aggressive, and indulging in addictions or violence towards others. So we know that trauma leaves us at greater risk for physical illnesses, such as diabetes, heart disease, liver disease, but also chronic physical pain, you know, just, and having referred pain, you know, maybe you've injured your foot, but your knee hurts. Maybe you've injured your arm, but your back hurts, and the pain can move around. And there's something else I wanted to say about physical health problems. Chronic illness, diabetes, heart disease, liver disease. It'll come to me. It'll come to me. Psychologically, having recurrent, unwanted, distressing memories. So one person said to me, every time I close my eyes, the movie comes on. And the imagery of the traumatic event repeats itself over and over again. I was driving down the road and a motorcycle was coming this way and his kickstand dropped down and he went up in the air and his motorcycle went over my car to the side here. For months afterwards, as I was driving, every now and then I would see a person go up here and a motorcycle go over there, up here and you know, and had that repeated unwanted thought going around in my head. Reliving traumatic events as if it's happening right now, well, that's a flashback. We call that a flashback. Upsetting dreams and nightmares about the traumatic event. And if you have, you know, an upsetting dream or a nightmare, or you wake up in the night, you can't sleep and you're flipping and flopping in bed, you know, the protocol is to get up, look around the room, to tell yourself, you know, I'm here, I'm in my room. That was then, this is now. And, you know, maybe walk around a bit and then go back to bed. But don't lay in bed and try and solve that because you'll flip and flop all night. You know, interrupt it, get up, walk around, and then go back to bed. Try to fall asleep thinking about gratitude, because then that will get incorporated into your dream life. Yeah, And triggers, well, I guess we're going to talk about triggers in a minute. This is the main message that you get growing up in a home where you're experiencing trauma, is that basically you don't talk, you don't trust, and you don't feel. And those can end up becoming lifelong messages that you carry with you, that you know, you don't talk about the secrets, you don't trust anybody, and you go numb. Another physical effect, you go numb, like you don't feel anything, or you may feel very little. You may feel very little pain, so that at one point in time, my kidney burst, and they tell me that that's supposed to be one of the worst pains, you know, up there with childbirth, pretty bad pain. And I didn't really feel it that much, but man, if I get a hangnail, you know, that can wipe me out. So there's distortions that happen. There's spiritual effects of trauma. Sense of separation from God. Where was God? As a kid, I was crying out to God, crying out and crying out, crying out. Or I ran an agency in Ottawa that worked with the homeless community, and we'd have volunteers come. We gave 8 weeks of training before you'd go out on the street. We'd do foot patrol on the streets, you know, bringing blankets to people that were freezing and bringing food and that sort of thing. And there was a wonderful volunteer. She'd volunteered with us for maybe 10 years. And she was a secretary in the church and a real godly woman. And she didn't do anything wrong, except maybe she took a bus home and she got followed. And someone was obsessed with her, followed her. And the next day he showed up at the church. Oh, Jack, I'm surprised to see you. Want a cup of coffee? Invited him in. And he sexually assaulted her on the altar. She ended up in a psych institution and for a long time, and her marriage broke up, and it was totally devastating. Now, every time our teams went out, we would pray God for safety. We would pray over them, you know, but this horrible thing happened to her. Sometimes the good thing about being in ministry a long time is you get to hear the rest of the story, because I lost track of her. And then probably could have been even 15 years later, I get a note from her that she's now an Anglican priest, and how God used that experience and transformed it. Even through the horror and the pain of it, transformed it into something that is now life-giving in her ministry. But that sense of, you know, and trying to recognize that, you know, God didn't want this to happen. People do what people do, and God helps us cope. But that's a tough one. The fear that you get after an experience like that is that maybe God is distant or he doesn't even exist. And then you start becoming super independent. Well, then I'm going to take care of myself. I think that's what happened to me. I thought I'm going to take care of myself when I decided and started thinking at age 8, I'm going to have to leave home to save my life. And you know, that independence can be an asset in some ways, but it can be a hurdle in others, in that you never ask for help. So a few years ago, I got cancer, and I couldn't do it on my own. But I had people who came to bring me soup or came to visit me that said, thank you so much for letting me help you, because you're always helping everybody, but I never had a chance to help you. And I needed to recognize that as being kind of pride and not such a good quality, and probably a quality that had emerged from the trauma. So The other thing is that you can feel like you don't matter to God, you don't matter to anybody, you don't even matter to yourself. And the ability to make sense of a traumatic event fits in with, okay, let me read this. The ability to make sense of traumatic in a way that fits with one. Oh yeah, okay. So in that sense, it can be turned around in that when you come to the realization of God's role in your life, when you come to the realization that what was meant for evil, God can turn around for good, that can lead to tremendous spiritual growth. I think that's what I was trying to say. And that's the hope. The other, it's amazing how God has made us to withstand all kinds of harshness. You know, one of the things he's given us as a defense mechanism is dissociation, the ability to dissociate. Not everybody dissociates, but a lot of people do. It's on the spectrum from, highway hypnosis. You ever drive and you see a mirage or you miss your sign and you just zone out. Daydreaming is on that scale. And then you get to some events that seem more transcendental, prayer, meditation can take you to a place of a different sense of reality. But as you move further along the scale, you can have what is like a fracturing of your personality. And I often think of the trauma as being like a rock thrown against a window, the window shatters, and there can be traumatic pieces where maybe you're told in your family and life that you can never get angry. Being angry is a sin. And so you convince yourself that you never get angry. But within yourself, you create a special folder or a special area that just holds anger. And you zone out to that experience whenever it comes up. So that ability to zone out and not be present, we see it sometimes in children that have imaginary friends. It may show up as, like I told you, in the spiritual abuse, where I found I had the ability to be lying on the ground, everybody's got their hands on me, but I could just like come up out of my head and watch myself. And that's a dissociative experience. I might feel like I'm just not present. I'm in a car accident and my car spun around in the wintertime facing the wrong way on the highway. And anyway, I dissociated. Like next thing I remember is a police officer yelling at me, and I'd walked off into the farmer's field. I just left my car on the road and got out and just walked the farmer's field, and I don't remember it. And so at the point of great stress, that may kick in, is that dissociation. So where it might have protected us at times, so as a kid, when I'd be tied up and be getting beaten, I could just zone out to some happy place in my head. They could beat me all they wanted to. I would never cry, and because I was in the happy place and I had somehow separated my head from my body. I see that a lot too I work a lot with sex trade, people being sexually exploited on the streets and those who've been trafficked. And many of them survive by their head is over here, their body's over there. And the two aren't connecting. So it can get to such an extreme that you may find that internally you've created other personas that you live out of. So you might zone out and one day find yourself in another town, and everybody's calling you Lulabelle, or something, or you've got a whole other persona, and and they call that a dissociative identity disorder, and even though it's said to be quite rare, I've seen it a fair bit in my work with the homeless on the streets. And, you know, the individual might create a whole new history for themselves or a whole new story about their life, that to such a point that they begin to believe it, even though they never lived it. We talked about flashbacks. You know, my mantra is, you know, that was then and this is now. I don't have that happen to me very much anymore, but to know that the ultimate goal of healing is to take the trauma story and put it in its place in my past, so I can be free to live in my present and hope for the future. So triggers, people will talk about triggers, and you know, and as I talk, I can't remember if you might have heard me say it yesterday or not, but that's okay. I'll repeat the stories. But I had a gal come into my office, and my office is in a family center. And so, you know, they've decorated it all. And she comes in, she's already agitated when she comes to see me. I'd never met her before. And she came and sat in the chair, and her eyes were darting all over the place like this. And she was really getting upset. And I said, I'm trying to get her to breathe, calm, you know. And she just goes, blood, there's blood everywhere. Well, the wallpaper was a burgundy color. She got up and she ran out, and I never heard from her again. And the next day we tore that wallpaper down. We got happy flowers until somebody comes in and goes, flowers. But triggers can be anything. They can be anything. They could be walking down the street and Joe walks by and I smell Old Spice. Ooh, I'm right back, you know? Or I hear a sound and it's like, my God, I remember hearing that sound when I was being hurt. Or, you know, smell is a very powerful one. And, or you might see something that reminds you. That's why I said at the beginning, if we talk about something and it triggers something in you, to take care of yourself, because anything can be a trigger. And so that's a reminder of past events. Touch is a big trigger. Some of us are in communities, church communities, AA, recovery groups, whatever, where we're very socialized to just hug people. Never hug without asking permission unless you know that person well. Nothing is more triggering than touch. You know, yeah, I've flipped a couple of people back in the early days, my 20s, when I was a little bit stronger. But, you know, I remember one elderly woman coming behind my chair and putting her arms around me, and me just tipping the chair, rolling myself on the floor and flipping her on the floor. And because I thought I was being attacked. And so touch is very, very triggering. So you want to ask permission, you know, do you like hugs? And like that, I might say, and the person will say, well, I'd rather have a handshake. Okay, I'll have a handshake, you know, but, or I'd rather not. Well, that's fine too, but always ask. And that's something that we need to be aware of in our cultures, you know, because many people will just, you know, they'll just come up to me, you know, and you know, and I always put my hands up and step back, you know, and say, oh, wait, well, I don't even know you, you know, like, I don't want you to touch me. And, but when I know you and we have relationship, you know, when I feel that, then yeah, we can hug. Trigger is lack of power and control. So maybe you get the job you always wanted to get, and then the first day on the job, you meet your boss, and he's an autocrat. He's a micromanager. He's somebody that reminds you of your abuser. That can be a big trigger. And you feel powerless, you feel out of control if you choose to keep that job. And, or you don't know how to handle that situation. So being in a position where you feel powerless or without control, like I'm sure many people that now, you know, a year ago found themselves in a happy country now find themselves in a war zone. Separation or loss can be a big trigger. Every grief in your present life calls up every grief in your past life. And so sometimes your reaction to a grief situation in the present can be ginormous. And I mean, grief is grief. It's different for every person. But those of us that have experienced multiple losses and traumas may find that it feels like it's totally devastating. Routine disruptions, scheduling changes, transitions. You know, the great prophet Bob Dylan said, the only thing that's permanent is change. And we hate change. I can't stand change. I like things to be orderly, you know. I mean, I roll with it now much better than I used to. I used to be pretty rigid, you know, just because that's predictable. That's what I can control. That's what I can understand. Even at that, I'm working on it, but sometimes someone will say to me, hey, Susan, let's go for a coffee, you know, tonight. And I'll go, well, actually, pull out my day timer. Well, actually, I'm free in 2 weeks on a Tuesday at 2 o'clock. Would that work for you? You know, and you know, and yet people sometimes think, oh, she's very easygoing, but I'm like, you know, and I'm sure some of that's personality, but I'm sure that some of that's also, you know, trauma. So we're going to talk about addiction. How long do I go till? 12 o'clock? Do we know? Anybody? 12 sounds good, eh? Yeah, okay. So here's a definition that an addiction manifests in any behavior that a person finds temporary pleasure or relief in, and therefore craves, suffers negative consequences from, and has trouble giving up. Okay? It's a mood-altering medication or behavior that helps you forget your pain with the hopes of replacing it with joy. All of us would like to have a joy-filled life. Well, when we're not feeling very good about our life, then all of us would like to seek something out that will reverse that and give us joy or pleasure. So we know, some of us know the connection between addictive behavior and the surge of that neurotransmitter called dopamine. Dopamine being the sort of the pleasure juice in the brain. And what happens is our brain naturally produces dopamine, the feeling of pleasure and experiences in life. But once we start replacing it with repetitive, obsessive behaviors and substances, then it stops producing at the same level because it becomes dependent on an external source. And that's why when people initially try to obtain abstinence, that it doesn't feel very good at first, you know, because the brain is just not producing the same happy experience that would happen if you got your full dose of dopamine. So it's all about how the brain feels pleasure. And sometimes in sobriety, you're not going to feel pleasure for quite a while. There's a situation called PAWS, P-A-W-S. Some of you know it, post-acute withdrawal syndrome. And that's how long it takes for the effects of the particular drug. And when I say drug, I mean drug, alcohol, you know, behavioral effects to get out of the brain. And some things like alcohol get stored in the fat cells of the body. And guess what your brain's made up of? Mostly fat cells. So that can last, you know, for some a year, year and a half later. I used to be the director of a drug treatment center at the Salvation Army. And what we would find is that, especially with some drugs like cocaine, that by about the third month sober, the person would be going into deep depression. And quite often need to be augmented with antidepressants for about another 3 months, just short term, in order to just keep working on recovery. And that's because the brain, the pleasure center is knocked out of your brain. Can the brain repair itself? Yes, yes, yes. The brain, like I said, is incredibly resilient. It with neuroplasticity, we know we can change the connections in the brain, and that the brain can repair itself. It takes work, though. It takes consistent, repetitive work. So the different stages of addiction. The first stage, experimentation. You know, you're just starting out and you're going, oh yeah, this feels good, you know, and then you're starting using on the regular. And then you start getting to high risk use where you're starting to have negative consequences from your using. You know, oh my gosh, you got caught checking porn. Oh my gosh, you know, you said you'd never drive drunk, but you got in the car and things were wobbly. And then into stage 4, which is what we call clinical addiction, which is where, you know, you live to drug and you drug to live. So we're in a society that criminalizes addiction, you know, and we look at, I'm not going to go into this a lot, just looking at the time here, but the legal drugs, illegal drugs, you know, if you do illegal drugs, you could end up in jail. If you do legal drugs, you don't get arrested. Legal drugs being that if today they said, hey, we want to introduce to society alcohol, caffeine, nicotine, sugar, yeah, they wouldn't legalize it. They wouldn't legalize it because so many people die from those addictions. And yet their society's acceptable way of coping. The illegal drugs are the unacceptable way of coping. And I personally think, and like I said, when I ran this addiction center at the Salvation Army, it was for released offenders. And I don't think that addicts who are not violent, I don't think they should be imprisoned. I think we should have a whole different system. There you go. And the other thing is we're looking at, you know, when is something an addiction and when is it a passion? You know, you might have, well, maybe, you know, we're not putting drugs in that category, but behaviorally, you know, maybe you really like playing golf and you have to do it like every day and it brings you joy and you love it and it's a passion. Or is it an addiction? Is it a way that you avoid dealing with the present? Is it a way of, you know, of trying to get that pleasure outside of yourself? It's a question. I think, oh, there we go. I often think too that, you know, I love the 12 steps. I'm grateful having been in Narcotics Anonymous for initial years of my sobriety. And I've been sober since 75. And, but we need to have a trauma lens. We need to find a way of making the 12 steps so that it reflects through a trauma lens. Because majority of addicts have experienced trauma. Bill W. did the best he could do in 1940s, but he didn't know about trauma. And so I would love to see, you know, a marriage between the two streams. And in fact, almost all the addiction centers that you have to pay for, you know, your $3,000 a month addiction centers, they do concurrent disorder. They do the two at the same time. But most of the centers that are covered, you know, through government, don't offer help for any kind of mental illness or trauma plus addiction. But what happens when I come and I take away your medicine? I mean, the reason that you're taking the drugs is because you want to survive your trauma. As soon as I take that away and you start acting out in my treatment center, then I'm going to put you out. And so you've got this huge revolving door going round and round and round. And the studies are saying they feel pretty much that repeating relapsing individuals are doing that because of the trauma, probably complex trauma that they've experienced in their life. So if we did that, we'd have to overhaul the treatment centers. You know, we would have to have trauma-trained counselors. We would have to have trained counselors, period. And in order to understand some of the clinical dynamics of mental illness and trauma as it relates to addiction. And I think that we're recognizing more that when you're dealing with two streams, sometimes you have to take a harm reduction approach, because stripping away the person's coping strategy all at once without them having something to replace it with, you know, can lead to a crash and failure. So those are all just future things. Person who's using substances behaviorally has a much, you know, conditions them to more increased trauma in their life. I don't know if that's good English, but you know, predisposes them. And of course, we know that where there is addictive behavior and trauma, that increases the possibility of all kinds of psychological problems. So the fact of the matter is, like I said, that mood-altering substances and behavior is often used to self-medicate. You know, and I said this yesterday too, that I came to a place where I had to thank God that I discovered drugs at the beginning, because I was so suicidal at the beginning, that the drugs numbed me out even more, and I was able to keep plodding along. Well, until the drugs became a problem, you know, and then it wasn't such a good idea. We know that if you're heavy into your addiction, that increases your victimization. Working on the sexual assault response team, the majority of the folks who came in had been sexually assaulted were when they were intoxicated. And of course, there's no consent when you're intoxicated. So that is sexual assault. And also, if I've experienced great trauma in my past, when I'm substance using, I will show more trauma symptoms. So there was more self-injury, cutting, burning, you know, self-sabotaging, this sort of thing. So, wow, how did that happen? Okay, so I'm talking about the marriage between addiction and trauma. And I don't think I've ever met a woman who used drugs or alcohol that wasn't abused, that wasn't traumatized at some point in time. And don't forget, we didn't really know about trauma until the 1980s. You know, and I was sharing this last night, that it wasn't until the Vietnam vets came back from war and came back displaying all kinds of unusual behavior. You know, there was such an increase in violence in the home, or there would be, you know, the drop and roll, you know, they'd be going down the street, something would trigger them to hear a loud sound or something, and they would drop and roll like they're on the Ho Chi Minh Trail, and you know, have real freak out reactions and feel like they're back in the war. And this Dr. Bessel van der Kolk, he studied the war vets from Vietnam. he came up with the term post-traumatic stress disorder, because before that, there was all kinds of disparaging labels that were put on people who came back from war, you know, damaged. They, you know, they were considered to have no courage. They were considered to be weak-willed. They were called shell-shocked. There was all kinds of terms that were used that weren't very good terms, and there certainly was no help or sympathy for these folks, even though they'd been sent to war at age 16, 17, 18, and the expectation was that they would just come back and carry on with their life. So he's out of this, Dr. Bessel is out of Harvard University, and across the hall from him was a Dr. Judith Herman. And Dr. Judith Herman was studying the emerging women's movement. And what was happening in the women's movement for the first time is that women started gathering together. And remember, I said that the rules were don't talk, don't trust, don't feel. That for one of the first times, these women were starting to talk. And they were talking about incestuous behavior. They were talking about sexual assault. They were talking about some of the secrets that were happening in their home. And Judith Herman came up with the conclusion that this was a syndrome. And one day she went to lunch with Dr. Bessel van der Kolk, and he described what he saw with the Vietnam vets. And he said, yeah, this is, you know, a soldier's illness. And she said, but it's identical to what I'm seeing with women. And that was the beginning of them realizing that trauma was much bigger than what either of them had previously thought. And so the very first seminal books on trauma and recovery were written by each of them. Trauma and Recovery, I think, was written in '95 by Dr. Judith Herman. And then Dr. Bessel van der Kolk's book is The Body, keeps the score. Body Keeps the Score. And, you know, I've been very privileged to have sat under their teaching over many years. And from that, it's been a really slow start. The word trauma has been a real political issue. Political issue, why? Because probably of the power of big pharma, the pharmaceutical industry. There is no medication for trauma. Oh, they can give you pills for depression, for anxiety, for all kinds of things, but not for trauma. And so even the term complex PTSD, which has been on the books, Europe has a different classification system than we do in North America. In Europe, for the last 12 years, they've had complex PTSD as a diagnosis, but we don't have it here in North America. Though any therapist that knows anything about trauma knows that there's a clear difference between the two. And also the approach in caring for the individual, you know, needs to be streamlined according to, nobody fits in a box with a label that says you're PTSD, you know, but the other thing is that DSM, which is a diagnostic manual that is used by doctors to decide what ailment you have, is also just a classification system. And you know who funds the development of that manual? Can you guess? Pharmaceutical industry. That's why the last manual, there was a big push on to get complex PTSD put in. But at the end they did, but they added 10 new diseases for children. So your child doesn't have the terrible twos anymore. They've got oppositional defiant disorder, and there's pills for that. And they've created all kinds of other illnesses so that we're medicating our children. That's problematic. The thing that's also greatly problematic is my friend Lance just graduated as a doctor, went to school for many years. He got 1/2 day training on addiction and 1/2 day training on trauma. But what I'm saying to you is that according to the latest studies, is we're starting to realize that trauma is at the root of a whole lot of medical problems. But it isn't in the medical world. where they still have a dualistic system where the head is over here and the body's over here. When you come in, you know, oh, you've got stomach problems. We're going to focus on your gastro, but how many people here have ever been asked by their family doctor if they've experienced trauma in their life? Not too many. And, or the impact of what's going on psychologically with you instead of just focusing on your stomach, right? So what I'm talking about is a paradigm shift into an approach that's much more holistic and which recognizes the flow in your body. You know, what happens to you psychologically, if it's in the mind, it's in the body. That's a truth. And so we've got to recognize that interconnectedness. And this isn't some, you know, new age mumbo jumbo. There is some very, very solid studies being done at the major universities. The biggest one being Harvard University has got a huge trauma center. The problem is, and it was quite interesting because I went to the International Congress on Trauma in Ireland in Belfast, and Dr. Bessel was there. And I guess he's freer to talk about North America when he's not in North America. But, you know, just saying how hard it's been to get the funding to even fund some of the research, that constantly he was chopped down every time he tried to push forward in his research findings. But I think we're coming into a new age, not new age, but new age, you know, because we're talking a lot more about trauma. When I first came here, even to Prairie 12 years ago, we didn't talk a lot about trauma in terms, and we certainly didn't talk as much about linking it with addiction. Because, you know, Bill W. spoke the truth at the time, his time in the 40s, that said that addiction is the primary problem. Alcoholism is your main problem, because there wasn't the knowledge about trauma, and that in fact, the addiction is a symptom. It's not the main problem. The main problem happened years before. And what happens if I just cut the head off the dandelion in my garden? Well, it's going to grow two heads, you know, it's going to keep multiplying, right? And we want to go and we need to pull the roots out. We need to re-examine the origins and the roots. And they also came out a couple of years ago saying, because initially in trauma, we used to have you reenact the trauma. You know, there was a method that was used many years ago called rebirthing. Anybody ever hear of that? Where you just kind of, yeah, visualize yourself kind of being born and going right back to the, well, so many of the early traumas were re-traumatizing. You know, if you keep telling your story, your horror story, you're digging it deeper and deeper, and it's becoming more entrenched. We don't have to keep telling our story till we desensitize ourselves to somebody else. Yes, okay, the time may come to break the silence. I can talk about my trauma story, but it's not like right here, it's back there. But when you're initially going into a healing process, the retelling can be traumatizing. And sometimes you may meet somebody and very quickly they'll say, oh, hi, I'm Susan. I was raped at 5 and then sexually assaulted at 8 and da, 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 like that. No boundaries. Part of it is that their body craves the feeling of being re-traumatized. You can get addicted to your own adrenaline and your cortisol rushes. So what we do now instead is we need to start by going into the body, create a safe container in which to hold the story of trauma. And then from there, you know, go into remembering and mourning and processing. And we can do that without me hearing the story. I can just say, okay, go back in your memory. Keep it in your memory, you know, on a scale of 1 to 10, where's your distress? You know, and I can take you through a process so that we start to bring down that scale. You don't have to say it to me, but we'll go, okay, your distress is at 8. What are you feeling in your body? What's happening here? How do you take care of your body? And then try again. And that will lower the impact that the story has. It desensitizes the story, but you don't need to speak it out. You don't need to hear it again. It's already floating around in your head, but you don't need to speak it out and hear it again, you know, and see my look of horror and see my, you know, and have that whole big experience. We can lessen it. So there are ways that we can deal with it in that way. Why don't I just open this up for if there's any questions about what I talked about this session? Do you have any questions? Hi there. No? Oh, yeah, you like throwing that at people, eh? Yeah, okay. Okay, yes, here's a question here.
Just
Catch.
speak into the box.
For chronic pain, like you were talking about, the phantom, like from past trauma, when it affects you physically, like sometimes I get a really weird sensation on the side of the head where I've been hit so many times. How do you deal with that?
Yes, yes. So what would work is one of the therapies that's quite good is EMDR, it's called, which is like, it's like a bilateral eye movement therapy, like I was talking about, where we zone into the pain. I'd have you imagine what that pain looks like. What is it trying to tell you? What, you know, trying to pull the meaning out of the pain and see if that doesn't help to lessen it. Now that's presuming that there's not a biological reason that you have that pain. There's not a, you know, it's coming right from the injury itself. But we can lower the psychological effect of that pain.
Because with chronic pain, like I have from abuse and
Yes.
other injuries that have happened. So when you know that, okay, it's chronic, you know it's there, but when it keeps surfacing and you don't know for sure if it's from the injury or if it's an actual
Right,
phantom.
right, right. Well, and that's something that you can work through with a therapist. And I think that the practices that would come around that would be mindfulness, would be, you know, working with reframing what that pain is trying to tell you, you know, what the meaning is behind that pain. And it isn't that necessarily the pain's all going to go all away, but you may be able to tolerate it in a new way, you know, by working with some, I think that with chronic pain, it works quite well when you're doing that, a process like EMDR, it's called. Mm-hmm. Any other questions? Question in the back? There you go.
I just got trauma.
Oh, yeah. Take a deep breath. Take
No,
a
just
deep
joking.
breath.
Can you explain a bit more about the epigenetics? Like, does it pass from generation to generation? Like, if one generation after the trauma, they're children from that person, and
Well-
they don't have trauma in their family, does it still, is it a pattern in their genetics?
Yes. Yes, from my understanding, not a, you know, a bioscientist, but well, from my understanding is that there's a genetic marker for the trauma, and then it affects your level of resiliency at birth.
So the
Now that-
parent, the original parent who had the trauma has children, and yet each of the children, they have a okay family home, but their genetics.
And like genetics, it can skip generations. It can, But I think that you can have, let's say the mom has 5 children. She may have had trauma in her past. She may be feeling really stressed out on a particular pregnancy, and that child may be very different than the other children. But that is a relatively new science too, probably in the last 5 years or so. And made some sense for me. My mother was a teenager in Nazi Germany. And only imagine the horrors that she saw and experienced, and then she was multiply assaulted when the Russian soldiers came in. And so I'm sure that's had an effect as well. So what that means is that, a person that doesn't have, and this isn't mother blaming, it's just his physiology, but that a person who has been born from a mother who was greatly stressed, may not just have what it takes to be able to handle even the simple stressors in life. May fall in on themselves, may be super shy, shut down, may be acting out, may take on any of the roles that we see, those roles that we see from children of alcoholics or children of dysfunctional families, be the mascot, be the hero child, be the lost child, may take on different roles in the family because of their level of resiliency. So I think there's a lot of study going on now, especially with our increased sensitization to the plight of the Indigenous person. And as a society in Canada, we have a long way to go, but we have taken some strides in that direction. And so there's more research going on now.
Okay,
in that
thank
area.
you.
Okay. Anybody else? Hello.
Hi, Susan, I don't know if this is going to apply directly, but you mentioned that this is relatively new trauma. And years ago, I read some books by a doctor by the name of Paul Tournier,
Oh, Paul Tournier, yes.
and he talked about
Did.
he was talking about that then, wasn't he? To a
Yeah,
certain degree,
well,
not
yeah,
to the degree now, but
I think people have put the conclusions together, and Paul Tournier was a great Christian Swiss psychologist and wrote amazing books. I don't know if they're even in print anymore, but they were really popular, I think, in the, what would you say, 80s, maybe?
I read
70s,
them in
80s?
60s.
Oh, back then. Okay. So, but yeah, I think that there have been people that have been wondering and seeing patterns, and now we're just getting it validated by scientific research. Yeah, good point. I haven't heard his name in a long time. That's good. Anybody else? Yes. So got a long
Are
toss
you a
there.
catch?
Yeah.
No, well, here you go.
Just on the topic of books,
Yes.
if through the day there are books that you would think would be good resources,
Mhm.
we as Carn, and even just for mentioning for individuals, if you could give us some of these books. So
Oh,
that
yes.
the titles of them. we would
Yes.
Love that.
Yes.
So that
Yes.
we can add them to our library, put them in the public library, things like that. That would be super.
There are some, some good Christian books, and there are some really good non-Christian books as well. That probably one of the best books I've read about this whole connection between illness and inflammation is When the Body Says No by Dr. Gabor Mate. And that's a real eye-opening book. He says in that book, for example, that in quite a large study, that I think it was over 90% of women that had had sexual organ surgery had been sexually abused. Very high number. And so, yeah, that book is quite interesting. Well, it's about 3 minutes to 12. If we have room for one more question. Okay, here we have this young lady here.
Just quick, how does the self-harm fit in with I don't know, is it a coping strategy?
Oh,
What
yes.
is the self-harm thing that?
Yeah, the
person's
self-harm thing. Well, it can be replicating the trauma. If when the trauma has been kind of normalized, like this is what you've experienced, that that then your self-loathing, which is what you may be experiencing, might be a way of using cutting, burning, whatever, hair pulling or whatever as a punishment. Or what I hear mostly is individuals saying that they are numb most of the time and cutting themselves, which causes endorphins, the pain relieving juice in your head, that gets deployed and it feels like taking a tranquilizer or smoking a big fat joint. That it just, the problem with that is that the person, we don't say that that's necessarily suicide behavior, but we call it parasuicidal, in that the person may end up cutting themselves the wrong way and dying, even though dying was not their intention.
Interesting. Yeah, I was thinking of my brother. I know he's been traumatized, but he's like in his 50s now, but he has literally bitten his fingernails off. They won't
Yes.
grow back anymore. 'cause he bit
Yes,
them.
yes.
And I'm just thinking, doesn't that hurt? Wouldn't, it doesn't hurt anymore, obviously,
Mhm.
but during his youth and adolescence.
Well, I guess too, if you've encoded the message that you're a bad person,
Yeah.
you're so bad, then, you might be thinking you need punishment. And it might not be cognitive, it might not be an awareness thing, like, oh yeah, I'm gonna bite my nails off because I deserve to be punished.
Yeah.
But it may be very unconscious behavior.
Yeah, it was almost like an OCD for him, really.
Yes, right, right. Well, and this is where you can see great links between the effects of trauma and a lot of different conditions. We talk about axis 1, axis 2 mental health disorders, with axis 1 being your more psychotic experiences, schizophrenia, schizoaffective, this sort of thing. But the axis 2 being all your personality disorders, everything from psychopathy, sociopathy, antisocial personality disorder, histrionic behavior, narcissistic, obsessive compulsive, borderline personality. And we'll talk about that one. Dr. Judith Herman says that's a sophisticated insult to be called borderline. But anyway, we'll talk about that in a bit. But that these are all trauma responses. These are all survival strategies that somebody latched onto. Okay, if I do this, it helps me feel calm. I feel better, but they're maladaptive. They may be survival strategies that worked as a little kid, but now I'm 50 and it doesn't work so well anymore. Right? And a lot of the counseling that I do is looking at behaviors that I need to say, well, that behavior is pretty ingenious that you at age 6 years old discovered that you could do that and it would make you feel better and survive. But it stopped working for you long time ago. Let's upgrade. That sounds very different than saying, oh, you've got a pathological illness. Let's stick the label on you, or let's blame you when you keep going back to that behavior. And like I said, you don't want to be snatching out people's survival strategies without having an alternative to bring in. Yeah. Okay, now we're at lunchtime. Enjoy.